Or is this considered to be at no cost to the employee? And yes, so we are able to offer any available free testing to employees. And a lot of times what it comes down to, and that'll be considered no cost, but it comes down to convenience and time, right? If I'm required to send somebody for testing because I'm in an outbreak, that's going to cost me money. It may be cheaper to pay for the test and have somebody come on site, particularly if we think there is an outbreak occurring and we want to quickly narrow that down and stop the spread. It might make sense to have people come on site, but no, sending people to free COVID testing is perfectly fine under the emergency regulations. So why does the standard use exposed workplace instead of a percentage of the workforce or some other method? So you may recall from previous webinars where we talked about the work comp presumption. You have to have 4 employees or 4%. And in Osha, we're looking at an exposed workplace. So, and Osha has determined that focusing on that exposed workplace is going to slow the spread of the virus under their standards. And so we're looking at a floor, a field, a packing house, so a contained area where people are interacting. That's your exposed workplace. So if you're in a 2-story building, it doesn't necessarily mean that it's both floors. If you're working in different agricultural fields, but they're side by side, those might be different exposed workplaces. And then we're looking at, okay, now what are our common areas where people are going into, such as hallways, bathrooms, and for us, it's really where people take their meal and rest periods, right, the break room. That would be a common area that would be considered an exposed workplace, and that may be where you're tying in your 3 cases to reach an outbreak. So how does an employer determine what part of that exposed workplace for determining if an outbreak has occurred? So again, we're looking at that common area, any working location, working area during the high risk period. So that's 2 days before you start showing symptoms and 10 days after, or if it was determined by a test, then it's the date of the test, 2 days before, and 10 days after is considered your infectious period. And so then we examine that and say, okay, when was the employee on the work site? And then we track their movements. Where were they? So we can determine where our exposed workplaces are. If you're momentarily passing through and you're wearing face masks, that's not going to count as an exposed workplace, but it's got to be momentarily passing through. So our break area is not going to be momentarily passing through. So that's why it's important to keep our employees really sectioned off so that if we do have an outbreak, we sort of keep that contained to our different crews and pods, and we don't mix them in between and have a larger issue. Next question is, can an employer separate employees into cohorts to reduce the likely spread of COVID-19? And the answer is yes, but that isn't going to stop any of the standards. So everything in the ETS, those emergency OSHA regulations still are going to apply, even if you're separating into cohorts. It's just a good practice. And so what we've been doing in agriculture is keeping crews together. So sometimes we would normally mix crews or send folks, one day to work with another crew and have more contact. We've been trying during the pandemic not to do that and to keep crews together at all costs so that we don't increase our possible spread in case somebody gets sick. So for employers who have several non-overlapping shifts, can those be considered different exposed workplaces? So like if you had a packing house and you had 2 different shifts, could this be 2 different exposed workplaces? And thankfully the answer is yes, as long as the area is well ventilated and you're following cleaning and disinfection procedures in between each shift. So that is, if you're not doing that now, I would do that so that you can get the benefit of having different exposed workplaces. So how can an employer measure the 14-day or 30-day period on outbreaks? So, last time we talked about there's two different kinds of outbreaks, right? There's your regular outbreak where we're looking at a 14-day window, and there's a major outbreak where we're looking over 30 days, but that's if you've got 20 cases or more. The regular outbreak is just 3 cases in that 14-day rolling window, and you're going to be looking at the testing date. So that's the date that you mark in the calendar, and you can say, okay, from this testing date to this testing date, was I in a 14-day window? And I think this answer on the FAQs is a little misleading because it really sometimes starts not with a test at all. It can be in order to isolate. It can be showing symptoms, right? So oftentimes test doesn't come till much later, and by then the employee is already not in the workplace. So I don't necessarily agree with just looking at the testing date there, but some of you have had folks coming in and you've been doing crew-wide testing, and that's been turning up some positive folks who didn't know they had COVID-19 because they were asymptomatic. Then you'd be looking at your testing date. So, and that's the date the specimen was taken, not the date the results came back. So what are the criteria for an employee exposed to a COVID-19 case in the workplace to come back to work? So this is one where we had the last webinar just gotten the news that an executive order had been signed, and the night before I'm furiously crossing out 14s and changing it to 10s. So it has to be 10 days that have passed since the last known exposure. So this is if I'm putting employees out because they've been exposed to COVID-19, so they were within the high risk period, 2 days before they first started showing symptoms, and 10 days after, 2 days before the test was taken, 10 days after. And then that person was within 6 feet for 15 minutes or more over a 24-hour period. I have to put that person out who's been exposed for 10 days since the last exposure. That's a change from what originally was in the Osha orders from 14. You could still do 14 if you choose to. And there are a few counties out there that have their own rules that want you quarantining for 14 days. So you will see some inconsistencies there. If the county says 14, if somebody orders you to 14, then you're going to go ahead and stick with that 14-day quarantine instead of the 10. But for most of you, it has been narrowed down to just 10 days. And then there are some special rules for emergency responders and healthcare folks that they can come back a little bit sooner. So does an employer have to maintain earnings, seniority, and all other rights and benefits, including the right to their former job, as if they had not been removed from the workplace if they're unable to work because they're sick? So this is the what if the employee is sick question. If they're sick, you are not paying them under the OSHA standards. So under the ETS, you're not paying them. But you might be providing them with workers' compensation if they got sick at work, or they might qualify for state disability insurance benefits, or you may be providing them with FFCRA if you decided to continue with those benefits. So that's the Families First Coronavirus Relief Act. If you're under 500 employees and you decided to continue with that, you may be paying them under that and getting your tax credit back. And then, and I'll give you a list at the end that I know of, there's a whole laundry list of cities and counties that have now implemented their own COVID-19 sick pay. So you've got to look at where you're working and how that employee became sick as to what sort of sick pay they're going to qualify for. But under the OSHA standard alone, if they're sick, you don't have to pay them. So does an employee with COVID-19 exposure who tests positive from the workplace receive pay while out, or excuse me, how long do they have to receive pay? So that's been a common question of, gosh, am I going to have them on paid sick leave forever? And the answer really comes back as no, it should really just be 10 days that you're paying that employee, because that's a typical exclusion period. Unless you're under some order that says you have to do it for 14, then that would be your maximum time that you'd be paying an employee who's not sick, who you've excluded from the workplace because they've tested positive. So that's your asymptomatic folks. And those who were exposed in the workplace that have been put out. So the maximum period of time they should be paid is about 10 days. If it goes longer than that, then that's an indication that there's something else going on, like maybe they became sick, or they've got something else, personally going on, or they got exposed outside of work. Then that would be a different story. So you're not under the OSHA standards anymore, and you wouldn't be required to continue paying them. So the idea is it should just be that short window of time. So must an employer exclude an employee who claims a COVID-19 workplace exposure? And so I've gotten this one quite a bit, where employees inevitably, they're going to learn how to game that system, right? And if they think they've got an angle where they can get out of work and get paid for it, they're going to look for it. If you gave, what happens typically is you'll send out a notice, hey, we had a workplace exposure, somebody in the workplace had COVID-19. And that employee is going to say, yeah, and I got exposed and I was within 6 feet for 15 minutes. I need to be out and quarantining because they want to get paid. So the answer here is from OSHA, look, take that report seriously and you should investigate. So if you remember from some of the prior talks we've done, I've talked about how important it is to do a good investigation each and every time you have a COVID-19 case, each and every time, because that investigation is going to benefit you. And in this case, you have to investigate, was that person within 6 feet for 15 minutes or more over a 24-hour period to that COVID-19 case when they were contagious? So 2 days before, 10 days after. And sometimes we even have video cameras and we can go back, and I've had clients who were able to watch that and say, you never got within 6 feet of that person, and certainly not for 15 minutes. And so we've got proof that we can hang on to show, nope, we don't have to exclude that person. We've done our investigation, and here's what we found. So OSHA's point is do a good investigation, document it so that if you get questioned on it, and you may, because they'll be mad they didn't get their pay, they're going to go run to OSHA and complain. What are you going to have when they come knocking to show that in fact they weren't entitled to that pay? So do a good investigation. So does an employer have to maintain an employee's earnings and benefits if they're unable to work for other reasons other than protecting them from COVID-19 in the workplace? And the answer is no. So if there's some other reason you were supposed to put them out, but the business laid off. So let's say we had a seasonal layoff, a normal one that we normally do, not a retaliatory one. Let's say the employee was scheduled for FMLA leave to go take care of a family member, or they had some other disability, or they had vacation that they were going on, then we don't need to pay them when there's some other reason why they were going to be out of the workplace. If that happens, that employee might be eligible for other benefits like state disability, paid family leave under the state program, or unemployment benefits, depending on what the situation is. But it's not going to fall under the workers' comp, OSHA ETS standard. So the ETS states that an employer is not required to provide exclusion pay if the employer can establish that the COVID-19 exposure is not work-related. What does that mean? So through our good faith investigation, if we're able to show that that employee got it by other means, we do not have to pay them, right, for that. So we're not required to pay employees who are excluded from work if we can show that their COVID exposure was not work related. And that's usually talking to the employee and deciding then, how they got their COVID-19 exposure. Maybe it's somebody at home, maybe it's something they did on the weekend or the evenings. And most of the time, how are we finding that out? We're simply doing an investigation, asking that employee, and they're telling us and being truthful. So that one doesn't come up as often. How are employers proving that a COVID-19 exposure is not work-related and rebutting the presumption under SB 1159, which is the workers' comp presumption? So work comp is presumed, that COVID-19 exposure is presumed to be work-related if you get 4 employees, if you have 100 employees or less, or 4%, then it's presumed to be work comp related. How do you overcome that it's not? Basically, you have to show evidence through your investigation that it's more likely than not the exposure didn't come from the workplace. So if you have a scale and you put a feather on the scale and it tips it ever so slightly, that's enough. So you just have to have just enough to tip that scale, more likely than not that they did not contract COVID-19 at work. That's going to help you overcome your burden and to be able to show under OSHA as well, that it's not work related. So you don't have to be 100% right, but you've got to do a good faith investigation. I would document it, because if you don't document it, it doesn't exist, right? So how will exclusion pay be enforced? That was another big question that we've had, is like, gosh, what happens if we don't pay them? Well, OSHA has the authority to issue a citation and require abatement, meaning you're going to be ordered to pay that person. So they're not speaking to whether another agency like the Labor Commissioner's Office could enforce it, but certainly OSHA can come out, they can issue a citation to you and require that you go ahead and pay that employee or employees. So can an employee receive both temporary disability benefits under work comp and their regular wages or a portion thereof if they're excluded? So this is a question that we had is, gosh, if the employee goes out under work comp, do I have to level them up? And if it's work comp, the answer is no, because basically you're receiving workers' comp because you're sick. So you have to be able and available to work to qualify for receiving pay under the ETS. So you can't receive both types of benefits. It's going to be just one or the other. And most of the time, they're not getting work comp. So if an employee is receiving temporary disability benefits through work comp because they test positive for COVID-19, but they don't have symptoms, then would they get exclusion pay? And it's no, it's really, it's either or. And quite frankly, if you're asymptomatic, you're probably not getting workers' comp benefits. So you are going to probably receive that ETS pay, maintaining their pay and benefits for that up to 10-day window of time. So, and that's at the same level as before, just as if they hadn't lost any time. So you don't want any type of drawback. So what should an employer consider before seeking a waiver from Cal OSHA to return to work? So there is a possibility, and I'll just go over this very briefly because it's not likely to impact very many of you at all. But if somebody's been exposed, but they're not actually sick, you have to put them out of the workplace, right? For 10 days of quarantine from their last date of exposure. Sometimes people can go and seek a waiver for that, but it's a very high burden. You have to show that putting them back into work would not create an undue risk to public health and safety. And you can call it in, but then you've got to give them something in writing. You have to show that that operation has goods or services, and the interruption would create an undue risk to our community's health and safety in order to qualify. So very high burden, and we have to show that putting them out also puts us in a staffing shortage. So it's not simply being critical infrastructure, because we're all, everybody on the line is typically in an essential business, but it's a different criteria here. So, and you can't request it because you think you'll have a future outbreak. So only when you're in that can you do that. And then this one just gives you the specifics of where you need to send that email and what you need to include, of course, business name, point of contact. You also have to show that there's no state health officer orders for isolation or quarantine to exclude that person or persons. And you have to really prove there's an undue risk of, to the community's health or safety because you're providing goods or services. And then you've got to show, if I put them back into work, how is it you're not going to spread COVID-19 through basically isolating them at work so they're not around anybody else, maybe using respiratory protection, which is a really high standard if you're not otherwise using it, or other equally effective measures. So very, very high burden to get out of that exclusion. Another question was on harvesting, the Housing for Harvest program. And this sort of reads confusing to me, but the idea is you can use this if you have to put somebody out and isolate them because they've either been exposed or they're actually sick. You can keep sick people together and you can keep isolated people together. But once they're in that, then the ETS standards really don't apply other than isolating them and quarantining them from each other. So many growers have rented hotel rooms for COVID-19 and positive employees to isolate them, which do not include a kitchen. Is that going to violate OSHA's standards? And the answer is not OSHA's standards, but remember, if you're an H2A, right, you have an obligation to either be providing that kitchen or to be providing them with 3 meals a day. So that still applies. So we're always overlaying laws with each other. Does the ETS housing requirements apply to H2A employees? Because as most of you know, in H2A, we're allowed to have bunk beds, we're allowed to have a lot more people in a room. And basically because the OSHA standard is more protective of the employee, that's going to be the one that applies. Those stricter requirements are going to take precedence, so that we're having to space people out. We can't use bunk beds. We have to provide the requisite space between people so that they can socially distance somewhat in that housing. And I mean, sort of fun fact, OSHA can cite you on not following the ETS standards, and DOL can cite you on their own rules about H2A, but they can't cross over. So they stay in their own lanes for that one. How does an employee enforce physical distancing and face covering requirements in employer provided housing? And essentially, the good news is here, we don't have to be the face mask police and physical distancing police in housing. So that's different than when they're out working. We just have to ensure that we're providing enough space to permit at least 6 feet of physical distancing between employees and providing enough face coverings so that everybody can have one, and then also training and educating them on the use of face masks to prevent COVID-19. So how will vaccines impact us here, right? They really don't. They don't, in that we still have to follow the standards, but the idea is that we won't have outbreaks, and we won't have to be excluding folks who've been vaccinated, so it's going to lower our risk. So it helps us come out of this pandemic. So another big question I've been getting is all the time, where do things stand with COVID paid sick leave, FFCRA? So when the Biden administration came in just over a month ago now, one of the things they wanted to tackle was adding paid sick leave, extending FFCRA, or adding new, I'm not quite sure which. That hasn't taken place yet, so stay tuned. The California Farm Labor Contractors Association does a really good job of putting out basically daily newsletters with the latest and greatest of what's going on. So I would watch that because as soon as there's a change to that FFCRA, they're going to put that in there and let you know. But as it stands right now, it's voluntary after January 1. that you can continue to offer that through the end of March and get your tax reimbursement. So it's up to you to opt in or out of that. And can you use that FFCRA to pay in workers who are excluded from the workplace? So that's a tough one, because you have to remember, you still have to go to the standard and make sure they're qualifying. Are they sick and seeking a test? Have they been placed under quarantine? Sometimes I'll tell folks, gosh, have you been placed under quarantine? Why don't you call public health and get ordered into quarantine? Because then you're going to qualify. And the reason I get so technical on that is because you're asking for a tax refund on that money. I don't like to mess with taxes. And so I make sure I check every box on that, because it could be that you don't really qualify for the tax refund if they didn't meet the standard. So I know you've got competing interests here. Department of Labor wants you to pay everybody. And I've had conversations with them of, that's great, but I'm dealing with the IRS here and I'm not going to step on their toes. I have to make sure that person qualifies. So maybe they'll qualify. Is the FFCRA going to be renewed? Probably, but what that's going to look like, I don't know. And then what about California? I'm shocked California hasn't stepped in and added more sick pay, but they haven't. This is a list of some counties and cities that have paid sick leave in effect. And so if you are ever working in any one of those, you need to make sure you're looking at those specific county and city rules with regard to COVID paid sick leave, because they are all different. And I can promise you, I have not memorized any of them. But you might get ordered to provide COVID paid sick leave because of one of those counties. It's constantly changing. So keep your eyes and ears open for that one, for your particular county's rules. Next, last thing I guess I want to cover before I turn it back over to Michael, and then I know we've got some Q&A. There was a couple court cases that tried to stop the emergency temporary standards for Osha from taking place. If there was going to be an injunction, we really should have heard something by now. I know there was further briefing that was scheduled to take place maybe 10 days or so ago, and no ruling has come out on that. So as it stands right now, it's in place, it's being enforced. And my suggestion would be to comply with it until and unless you hear otherwise, because at this point, typically you would have seen a court stop it if they were inclined to do so by now. So that essentially it's just not looking good that anything's going to come from that. So with that, Kim, I know we've got some questions. Do we want to answer those now or hold those?
Yeah, if that's all right. I think it makes sense to answer those questions now, just because they are really focused on this. So we had a lot of questions about the FFCRA. Let's see here. So if we don't pay them, are they under the emergency standards? They already depleted the 80 from the FFCRA.
Yeah, so if they've already depleted the money from, that's a great question. If they've depleted their funds from FFCRA, then you're paying them under the emergency temporary standards and you're not getting reimbursed. So not.
Okay. Mario followed up on that question asking, I thought you have to keep paying them if they're quarantined under the emergency standard, just under a different code.
Yeah, so you would keep paying them if you've used FFCRA. You would keep paying them if you're excluding them from the workplace and they're not sick. So it's a very narrow circumstance there. But if you're excluding them and they're not sick, you would continue paying them for up to 10 days under the ETS, but not beyond 10 days. But they come back to work, they work 2 days, they get exposed again, I'm putting them out again, I'm paying them again. So there's no limit on how many times that 10 days can come up under ETS. So you could be doing it again and again. So it's just more incentive for us to make sure that we're really watching our workers and trying to keep them separate. I see another question was on the tax credit expiring December 31st, 2021. Not to my knowledge, unless you saw something I have not seen in the last 24 hours. Could be I didn't read my news this morning yet, but unless that came down last night, not to my knowledge.
Then we had the question about if an employee has a doctor's note stating they can come back after 10 days. You've heard anything about
So that they're not being excluded by us if their doctor's note saying they can come back by 10 days. So then you have to look to, so it's not under the ETS that we'd be paying them. You have to look to, am I offering FFCRA? Have they already used it? And if I'm not offering it or they've already used it, okay, do they have California paid sick leave that I can pay them sometime for the 3 days? And then beyond that, does the company have a sick leave policy that they might qualify for? Beyond that, then they look to state disability benefits potentially. If they got sick at work, potentially work comp. So each one, you kind of got to examine each situation and say, okay, let me tick through these and see which one might apply.
All right, some of these questions we're going to hold until after we hear from Michael, but I do want to address this one. We have two questions asking about if they're exposed at home, if they need to pay that.
No. So if they're exposed at home, that was one of the FAQs, thankfully, that says, look, if we can show it wasn't at work, and that was based on their word, right? We're not paying them under ETS. Now they might qualify under FFCRA if we're still continuing to offer that, or under one of our local paid sick leave programs, but not under ETS, thankfully.
So would you suggest they apply for state programs such as disability?
Yeah, I would. So, and if disability turns them down, then if we look back to the ETS standards, I'm always looking at it because I've always got it printed out and by me. Then we look back here and go, okay, did I have to exclude them? Then I might have to pay that or make up the difference.
All right, excellent. Thanks for answering those. We're going to hold the rest of the questions till the end here, and we're going to bring up Michael. And Michael, I do have your presentation now, so let me share that if you want to come on screen and on audio.
Excellent presentation, Erica. Hopefully, most of the questions that folks have out there, certainly they've been answered from my perspective. So thank you again for your presentation. You know, and to piggyback on what Erica provided, you know, one of the most important things that we have to keep in mind is the goal of prevention. And, you know, if we can put our energies in that prevention, then many of the things that Erica brought up, hopefully you're not going to have to encounter that in terms of, you know, the infection at the work site and the spread of the infection. So let's go ahead and next slide. You know, I know many of you already have this information, but I want to recap on that for those that that don't or may have forgotten. One, again, to keep up with some of the changes and updates and the standard, its application. Just you know, go into our website. I mean, there's the dir.ca.gov, or you can just Google search Cal OSHA or COVID-19. And as you can see here on the screen from our department, you have the three divisions. You have Cal OSHA on the left side there that protect the workers from the coronavirus or the COVID-19. In the center, some of the things that Erica was talking about in terms of the compensation, the laws, the pay, that's under our Division of Labor Standards Enforcement. And also one of the things she had mentioned too was, you know, the workers' comp, and then there's the Division of Workers' Comp. So again, that's under the department. And even if you Google search Cal OSHA, you go on to the far left website. Through there, you can also link and navigate into labor standards enforcement as well as the workers' comp. Next slide. Now, into the Cal OSHA website, you know, we have it in most of our web pages, both English and Spanish. Here is an example on the left side. the information on our website in English, and on the right side is in Spanish. And there's a little icon right on the upper right where it will say, you can click on for Espanol and or vice versa. Going down on that left screen, you can see where it's workers and employers. You need information from the workers' perspective. It's all listed there. And then also from an employer's in terms of, let's say consultation services, permits, certifications, things from an employer's perspective that you'll need to check on or get further information. You click on that, opens up the site to that information, and also links to other providers. Okay, next slide. Of these last few slides, this is probably, and I'm going to be a little biased on this because I did retire from the consultation services. This is something, if you haven't used the service, I highly encourage that you do. As Erica brought up, there's constant changes. And how does that apply to your work site? Well, I know firsthand from the consultants in the area offices, they have been doing a tremendous job and keeping abreast as to what some of these changes are, the application to the safeguards, and not just COVID, but any other risk factors or hazards or programs or developments in standards or applications of standards, partnership programs for just about all industries here in California, general industry, construction, agriculture, and so on. So again, it's a free service. It's confident, the information that you share with the consultants is confidential. They don't go running off to enforcement and tell them, guess who I was helping, or guess what I found over here. No, it's between you and the consultants. It's a prepaid service through your tax dollars. And, again, I strongly encourage that you contact the office. I'll get a little bit more into the COVID prevention plan program, and develop your program, and you want to get an opinion as to whether it meets the standards or if there's anything that you need to do to improve on that program, you can contact them and they will help you in development and the assessment of your, whether it's COVID prevention or the injury and illness prevention program or any other programs, and keeping you out of harm's way, and certainly helping you avoid any citations from our sister agency, which would be enforcement. Next slide. And you go into the COVID webpage, and this is what will come up. Again, English and Spanish. And one of the things that Erica had spoken quite in detail were questions and answers. And we have this posted here onto our website. From the top, you see the COVID-19 Emergency Temporary Standard itself. You click on that, and that opens up to the standard itself. Then the next one is guidance by industry. These are, guidance documents, things that will help you that apply to your industry. And it's not just guidance documents from us, but we link over to other providers, for example, the California Department of Public Health, Governor's Office, and even some of the federal sites. Frequently asked questions. This is some of the things that Erica was addressing, and questions that are brought up to our attention. We get sent this up to our team that is specifically working on the COVID-19 to answer these questions, and then those are posted. So again, many of the questions that you have, others have asked. They're important, and so that way you're getting it right from the horse's mouth in terms of what these answers and the interpretation and application, as opposed to maybe contacting one person in one office, getting another person in a different office where you may have a little different in terms of an answer or the interpretation. Here, it's right from our headquarters. Educational materials and other resources, fact sheets, videos, written safety plans, and I'm going to get a little bit into that. So this is where you can click on, download, print it out, and use it. Again, it's open to everyone who has access, and certainly we encourage that you go into these sites into the site and find the materials that best apply to you and that can help you. Webinars, just what we're doing here. Osha not only will participate and others, and I have to extend a special thank you to Lupe Sandoval for offering us the opportunity to share this with you, as well as Osha Consultate or Osha itself, and the department also hosts these series of webinars. And the Osha Training Academy, the courses that I've actually taken are very useful and very informative. Okay, next slide. One of the things that I shared with Lupe is that, I want to start with some encouraging news. And as Erica had touched also on the testing and the vaccinations. And this is under constant change and developments. And the good news about this is that it's rolling out. I am of that senior age where I actually personally took my mom and my wife, and we both were vaccinated and just received our second vaccine. And there's a lot of questions out there in terms of the effects, and we've had very little side effects on this. And, this is something that the agency as a whole, we encourage, the testing as well as the vaccination. And as soon as you're able to, we strongly encourage that you vaccinate, and also encourage your employees to vaccinate, and also inform them of the benefits of this. So a lot what Erica was addressing in terms of, dealing with the spread or those infected, this is, a big part of the answer, and trying to, just minimize or even eliminate the spread of this virus. I mean, yes, there are all the things in the emergency standards and the injury and illness prevention program, and maintaining all the proper safeguards, the distance, the mask, the engineering controls, and the education. But also, right along with this is the vaccination itself, and even after the vaccination, continue to implement these safeguards until basically we have complete herd immunity. One of the things that Lupe and I had discussed was that can an employer, make this or the state agency through the employers force the mandate and force people to take the vaccination. And, that obviously will come up in our Q&A. And as the program progresses and the vaccinations are more apt, the availability are increasing. And agriculture itself, I'm reading that there are, in fact, many mobile clinics out there now, and that's increasing. The age group is dropping where it used to be, above 75. Now many areas, counties are allowing 65 and older. And then farm workers, there's quite a bit of effort in extending that to the essential workers and farm workers. So as of right now, that would have to be in terms of mandating the vaccination to your employees. That was something that through your HR and your legal folks and your company policies will have to make that determination. The vaccine dosage, another piece of good news, as I said, it's increasing right there. So I'm indicating that the dosage given us about the 10th of February is about 4,700,000, and the dosage per 100 is 12.11, which now has increased. And so the dosages are much higher, and also dosages per 100 people have also increased as well. Next slide. One of the things that Erica brought up, the issues with many employers is that, whether you contracted the virus at work or out of work. And this is something that just food for thought here on the upper left shows that on this survey, that, a vast majority of the spread was on household and social gatherings. And on the lower left, you're going to see where it shows, social at the home, going to work, and then somebody outside. So again, it's not just, whether you're at home or at work, but also consider, those areas in between, because you have one person who's infected, and at home in your own household, you may be, feel that you're okay because nobody there has it, but you start interacting to the outside, and you do catch the virus, and then end up bringing it to work and then passing it on at work. The lower right shows, here's a little community here, and you see people there on the benches there, and you see others gathered and socializing. This is something that, you have to be very conscious of. And as an employer, educate your workers in the transmission of this virus and how easy it is to transmit. So the bottom line is you want to try to do everything you can from an educational perspective, and educating in the safeguards and minimizing those exposures so you're not contracting the virus out and then bringing it into your work site. Next slide. And again, I mentioned this before, but it is critical understanding your entire work site. As you can see here in that photograph in the upper right, if that person in the red shirt has the virus, and he's talking to and working along with the others, a perfect example on how easily it can spread. In fact, spread to the point where you're infecting the entire crew. Down in the lower right, if that's work site, somebody filed a complaint with Cal OSHA saying we're out here working, there's no partitions, there's no safeguard. The inspector goes there, and he's gonna, or she will have several questions. One, engineering controls. Compare that lower right to the upper left where you see the partitions. Face masks, the lower right does not, the upper left does. And the distance between the workers, the program itself, and the list goes on. So something like this, Cal OSHA not only can issue the citations, but they can also issue a stop order and stop the entire operation until those safeguards are put in place. In the lower left, as you see, even when you are in the grocery stores, not only the cashiers have the face mask, but also they have partitions and the training. And this is something that you want to extend to your place of employment. And also, again, like I said, educate your workers as they're interacting to and from and at or away from work, that these safeguards have to be in place. And this virus is 24/7. Next slide. Now, Erica made a point there in terms of the standard itself. Yes, it continues unless we hear otherwise. And even prior to the emergency standard, Cal OSHA was enforcing the injury and illness prevention program, because this is a risk factor, and it can certainly affect your workers' health and well-being. So again, as we are right now, the standard isn't full effect, and we need to do everything we possibly can to make sure that we're in compliance. Okay, next slide. Early on, one of the questions that Lupe asked me is that, Cal OSHA using the checklist. Well, the checklist that Cal OSHA uses is a standard itself. And as you can see here, even though these citations, the standard that the citations were based on was the Injury and Illness Prevention Program. And, I'm going to cover this a little later, but there's a side-by-side comparison between the Injury and Illness Prevention Program and the emergency standard. And basically what you're seeing here is the employers, failing to report the illnesses, not having a program in place to identify, correct, to train, to provide the necessary safeguards, whether they're personal protection, engineering controls, or administrative controls. And as you can see here, these employers are falling short and the penalties are being assessed. Their range here on that first one is a little over 32,000, one nearly 12,000. Temporary health services, temp agencies. This is something that, you, as a dual employer, both the host and the temp can also be cited for failing to comply and provide the necessary safeguards. Next slide. Well, the previous one also went into a little more detail in terms of the citations, but the one that you have right here, as I'd mentioned on one of the photographs, where there was basically no provisions made, and I had mentioned that an OPU or a stop order can be issued, and this is through the AB 685. And what does what is the Assembly Bill, the temporary changes that it provides or it includes? One, the employers to notify that all employees at the work site of potential exposures of the COVID-19. Employers are required to notify the public health agencies. Another one from the starting January 1st of 2021 to 23, that Osha can issue and will issue an order prohibiting use or shutdown. And, it's nothing different than, for example, when we were having to deal with the heat illness prevention and you go out on a high heat day, no water, no training, no breaks. Yes, Osha had not only issued the citation, serious citations, but also the order prohibiting use or stop order at the work site until the corrections were made. Next slide. Now, as I mentioned before, the Injury and Illness Prevention Program, and it continues to be the most cited standard with Osha, and I'm having a hard time wrapping my head around this because this standard has been around for such a long time. But there are the 9 elements there in the standard, and then on the right side you see here the Model COVID Prevention Program, which now is available. And, so whether you want this as a standalone or you want to incorporate that in your injury and illness prevention program, or even both. And again, I'm going to encourage that as you're putting this program together, your program together, remember that the consultation program is there to help you and helping you evaluate the program and making sure all the components are there. Next slide. And here's more of a side-by-side comparison. For example, on the COVID-19 prevention program or the model program that you can use, that first one on the top bullet, system for communicating, same thing on the left side on the prevention program is the third bullet, identifying, evaluating the hazards, same thing under hazard assessment in the IIPP, to investigate and respond, to correct these hazards. Training and instructions is also on the left side, third bullet from the bottom, training and instructions, physical distancing, face coverings, other engineering controls, reporting, record keeping and access, exclusion of the COVID-19. So the COVID-19 prevention program goes more into detail, and it's set up and structured that you can just go through it systematically. And as you develop yours, or if you have one already, to compare it to make sure all the parts are in place. Next slide. And I know that on the previous webinar, we covered this, but again, it's very important that you have this in place, because for many of you that want to avoid any citations, and I even think even more so to avoid the spread of the virus itself, would be to take this program to heart, apply it, and make it real, make it a living document, as opposed to, just having it in writing and putting it on the shelf. So as you start developing your program, again, is to educate yourself, who has the authority and responsibility, and developing this program and administering the program. Also, educating oneself in terms of identifying, evaluating what the COVID-19 hazards are. And as time goes on, we're going to learn more and more about this. Employee participation, because there again, they're the ones right at the work level, and they, their experiences is critical in maintaining this program. So you want a two-way conversation, communication. Next screen. Also that they feel confident enough and trusting enough that if they have any symptoms or if there are any weaknesses in this program, that they communicate this to you. It's vital that in terms of their participation, that say, for example, on the face coverings, that they understand the need for this face coverings and how it protects not just the person who's wearing it, but the person that they're interacting with. Some of the complaints that have come to us is that there isn't sufficient amount of safe face coverings, or the workers themselves have to provide it. So again, this is the employer's responsibility, just like any other PPE, to provide the proper amount of face coverings, the proper face coverings, and more importantly is the training and the use and the applications to this. Next slide. The engineering controls is something that is critical, cleaning and disinfecting, and this is ongoing, and this has to be in the program. For example, in agriculture, you're using tools and equipment, tractors. Do you have an operator, gets on, the operator changes, you got another shift change, another operator comes on, make sure that it's clean and disinfected. The same thing with the tools that are being used. Sanitations, as we think back when on the heat illness, where the field sanitations, water, all this was critical. Now it goes up to a higher level with respect to the COVID-19, making sure that you have plenty of hand washing facilities, that they're properly maintained and accessible. Next slide. One of the things that also come back is, on the face coverings, how quickly people will deviate from this. And by this, I mean, I've seen myself firsthand where people are communicating, their voices are muffled through the face covering or mask. And what they do is they pull it down below their nose to talk, to communicate. That's a no-no, because again, you have to understand the purpose of this and to have it properly placed and try to maintain that distance, because the droplets are airborne, and depending on the circumstances, I mean, you say 6 feet, but they can even go beyond that. So again, you want to make sure that it's properly used and its intended use as well. Methods for communicating, within your programs, that the communication, as I mentioned, has to be both ways. Also, encourage the workers in terms of their testing, where the testings are being given, and provide them the access and the means. And even now with the vaccine, as soon as the vaccine is available and the workers, depending on their age group or what they're doing, and if they're certainly it's available to them, encourage them to take the vaccine, because again, the more that we can vaccinate, the better off we are. Next slide. And of all, as with the injury and illness prevention program, it's one of the most critical elements here is the training and instructions, and that's going to have to be ongoing. Some of the things that I'm hearing in the work site and questions that have come to us about the hybrid training, blended training, is something that we encourage, that workers are interacting face to face. Well, if that's, for example, on the tailgate safety meetings, if that certainly is something that you feel that's useful and beneficial, yes, but keep in mind, if you're doing the field training or in-person training, maintain that distance, make sure that the individuals are wearing the mask during the training, and then also whatever tools and training aids that you can use or props, certainly encourage that. But again, you don't want everybody enclosed or bundled up. You want to make sure that the training, when provided, that you can keep the safeguards in place. Next slide. And again, the reporting, record keeping, and access, all this has to be in your program. And even in our website, we have links to getting more information on this. If you're not sure exactly what is required in terms of the reporting or record keeping. And I have to stress again, the use of the consultation, because you may have a question and you can't quite find it in our website. Please call them and give them the question with respect to, some of the record keeping and reporting requirements. Next. Giving you all this information in this period of time is nearly impossible. And this is a reason why I stress on our links and access points, because here, the questions many of the questions that come up, or questions that will be coming up, because as things evolve, more and more individuals are going to have questions in terms of the application of the standard, the interpretation, or how it applies to you, or how enforcements are going to enforce, segments of this. And this is, when you go into our temporary, the questions Q&A, and it actually has a table of contents where you can go right down, questions on enforcement, questions on the ventilation, or the vaccines, the training, the testing, and so on. So again, I strongly encourage that you go in and, periodically check into our website on the Q&A and find out, any additional questions that have been brought up, questions that you may have, or things that you may not have even thought of that maybe you need to address. Okay, next slide. And here's some examples of that. What are the testing requirements? And employers' testing obligations are as following, and it goes right down. And again, it's laid out very simple, easy to follow. Inform the employees how they can obtain the testing, offer the testing to the employees at no cost, periodic testing, and provide it in a manner that ensures employee confidentiality. Another question: is there a difference between offering and providing a test? No. The meaning is the same. In a non-outbreak setting, what employees are required to do when they learn that one or more of their employees had COVID-19, and then it goes into the employer's must, and you see the bullet points there: notify employees and their authorized representatives who may have had the 19 exposure within the business day, and then also offer testings at no cost. So next slide. So, and as I said, the list will continue to change, more will be added, and questions that you may have, send them to us, because if we feel that others can benefit in the answer, then we'll make sure that it's included and posted. Some of the publications, and here's an example. In February, we had several new publications. Click on that, it opens up. On the right side is an example of a publication when I was talking about where some of the employers are conducting, the hybrid type training, whether it's on webinar and then also in the field. Here's a good document that certainly can be shared, and even in the field, providing information with respect to the safeguards within COVID-19. Next slide. And that one's in Spanish. We have it both English and Spanish. When I made reference to the guidance documents, on the left side, here's an example of one for the grocery stores. That one too is in English and Spanish. You can see on the date, it's fairly new, October of 2020. On the right side is a continuation of the other previous document in Spanish, where it talks about maintaining the distance, Also offsetting beddings, the training requirements, other guides that are available. So, we have a host of information. This one was updated January of this year. So a lot of this information is current. Next slide. And here's something, again, a little bit more in detail and a close-up on the safeguards and the requirements. And again, I strongly encourage that you download this and print it. And if you need hard copies, contact the consultation office and see if they have any hard copies that are available for you. Next slide. And this is what I was talking about on the hybrid, something that I'm hearing more and more employers are starting to implement. And certainly we stand by this, whatever it takes to effectively communicate. On the upper left, you see an individual at a construction site. This was taken before. In fact, I took both of these photographs before the COVID-19, but where you can do a demonstration. Here, this is on heat illness prevention. And make sure there's plenty of open space. On the lower left, you can see where the workers are spread out. Obviously, now with the COVID, while they're doing this, the one person just to the right of the individual standing there with the striped shirt, you'd want this person further out, and you want to make sure that they're all wearing a face mask while they're out there engaged in the field training. So, there's different methods of training, and now that, and hopefully with the vaccine and the testing, there's going to be more and more the vaccinated individuals, and so the risk factor of contracting will be much less. Webinars on the COVID-19, we have not only for our site, but we link off over to other providers. Next. And they're very educational. And we do have online training. Also, as I mentioned, the COVID-19 guidance sheets, videos, I participated in these. So there's a host of information and training materials available. Next slide. And conclude with this, that we have the offices on the left side of the enforcement offices. If in fact you're an employee and you're listening in and your employer is offering a deaf ear and you feel that your only recourse is to file a complaint, these are the offices that you would call. If you have to report an outbreak or an illness, you would contact our enforcement office. If you're not quite sure which district, you can contact the regional offices and they'll tell you which district you would report that to. The good news is on the right side. For the majority of you that want to be proactive, whichever county you're in, Central Valley, Northern, the Bay Area, Los Angeles, Southern California, contact those offices, introduce yourself, and develop a dialogue and a line of communication with them. So that way, as you're developing your programs and you need assistance, they'd be more happy to help you. And that concludes it.
All right, thank you so much, Michael, and of course, Erica. We've gone a little over time here, but it looks like we have a question for you, Michael, if you might know this. Sebastian said that he was told by an EDD housing inspector that the 6 feet required between beds is actually based on pillow to pillow and not necessarily a bed frame. Do you know what that might be? And if not, do you know where to direct him to find that answer?
Well, short of contacting our enforcement office, I would say call the consultation office. But, again, the distance here, look at the intent. And the intent is that you want to provide that spacing. So as, in terms of a minimum, so you're not within that 6 feet. So which, in other words, which offers the greatest distance? Is it from the bedpost, the structure, the frame, or the pillow? And if it's the pillow that offers the greater distance, I would go with the greater distance.
So whichever it's more strict and gives a little
Correct.
bit more safety there, I suppose. Okay, great. Well, it looks like if anybody has any more questions, yes, the presentation will be sent out afterwards. We just need to wait for the recording to process. And we'll also be sending out copies of the presentations provided by Michael and Erica. So if there's any other questions, I know we're a little over time here, but we'll give it another minute to see if anybody has any questions for our presenters. And it looks like we're about wrapped up. So thank you so much, Michael and Erica, for your time and sharing all your insights. And of course, thank you to the UC Davis Western Center for Agricultural Health and Safety for helping bring this information by sponsoring this webinar. And thank you to our presenter, Lourdes, or excuse me, for our interpreter, Lourdes. Thank you so much. And it looks like we're about done. So we'll catch you next time and stay safe out there, everybody.
Thank you.
Thank you.
Thank you.